Hi, do you have questions about your Medicare and your Medicare Advantage plans? Well, I'm here to talk to you about what we see in the physical therapy world with traditional Medicare and the Medicare Disadvantage plans, as I like to call them. Why do I call them a disadvantage plans? Well, I've got a few things here on the screen that I will walk you through, and I'll give you perspective from a physical therapist that we see day in and day out. So take a look at this screen. We have traditional Medicare, and then we have Medicare Advantage, or like I said, the disadvantage plans. Here's what's going on. Access to doctors. Almost every doctor in the United States is participating with Medicare. Not so with Medicare Disadvantage. Here's why. Because the administrative burden and overhead that is associated with these disadvantage plans is astronomical. It's at least a 4-to-1 administrative disadvantage or problem when we have these. I'll talk about more specifically with physical therapy what we see in just a moment. Same thing with specialists. You don't have to have a referral to see a specialist versus with the disadvantage plans, most of them you do. So in other words, it's treated like an HMO essentially. So if you've ever had a HMO health insurance plan, you know what a hassle that can be. You've got to go to one doctor to get then referred to the other doctor. Also, access to care when traveling. Services are covered no matter where you live in the United States. Again, with the disadvantage plans, that may not be the case. So let's say you're on vacation and you hurt your back, you sprain your knee, you blow out a rotator cuff, throwing a frisbee at the beach. Guess what? Your coverage may be limited. Hospital stays and limits. No limit. The doctor is the one that helps decide versus in the disadvantage plan, it's the plan that decides. You have someone on the other end of the line looking at some diagnostic paradigm that determines whether you can stay in the hospital, which is going against, more than likely, the professional opinion of your doctor who's gone through schooling greater than 8 to 12 years. He knows what you need best rather than some insurance rep on the other end of the line. Same thing with your x-rays, diagnostic tests. Your doctor decides what diagnostic tests and procedures you need versus the disadvantage plans. Most of the time what we're getting is we're having patients come into physical therapy and they're having to do therapy because the physician cannot practice medicine. They cannot order the specific tests that they need to help determine a proper diagnosis for you until you go through your physical therapy sessions. Home health and medical equipment. Again, your doctor is deciding with you if you need home health or other services. Again, most of the time, the disadvantage plans, there is such a delay in getting approval and authorization that most of the time, by the time you're ready to discharge out of home health, that's when they're finally coming to say, okay, we can come see you now. All right, so what does that mean for you and physical therapy? Again, I'm discussing this from a physical therapist perspective, what we see day in and day out when patients that have traditional Medicare versus what I call the disadvantage plan. So let's take someone that is having a knee replacement surgery. Well, let's say you're having knee pain and you go in and you see the specialist, okay? And the specialist then determines maybe you need some x-rays and an MRI. In traditional Medicare, you go off, you get your test, and you'd come back and meet with the specialist. Then from there, he determines whether he thinks a course of physical therapy may help, maybe it's considered prehab, or the joint's bad enough where he determines you should probably go on and have a knee replacement. So on the flip side, you have this disadvantage plan. First of all, you have to go see your primary care doctor. They're going to then turn around and send you over to the specialist. Once you get in to see the specialist, if he wants to order further testing, guess what? Most of the time, that's not approved. There's a paradigm that the insurance company wants you to go through, and most likely, that's going to go do 6, 8, 10, 12 sessions of therapy on a knee that's already degenerative and worn out. So you would come in and see us at that point if that's what your plan dictates. Again, it's the plan dictating your health care, not your trained professionals, not your physicians that know exactly what you need. Okay, so let's say you eventually get a knee replacement and you're on traditional Medicare. At that point, you may have a discussion with your surgeon whether you go in and you do some inpatient rehab for a little bit. Maybe you do get home health services, or he wants you to come straight to an outpatient center. Those are discussions that you will have with your physician. You'll come to an agreement, and then the plan will play out. However, if you're on one of the disadvantaged plans, frequently they want you in and out of the surgical center as quickly as possible. If you do have some complications, it's usually a huge fight to get you approved to then either stay in the hospital or go into an inpatient rehab center if that's potentially what you need. What if you need home health? Again, we've had many instances where it's such a delay and such a hassle to get you approved with a home health provider through one of the disadvantaged plans, the surgeon ends up sending you directly to us after your knee replacement just so you can get the care that you need. And again, this all hinges back on not letting the professionals help you make appropriate health decisions. Now, what about the cost? There's various plans that you can look at between your payments from traditional Medicare, adding Medigap to cover the things that Medicare doesn't traditionally cover because it is an 80-20 plan when you use your Part B services, which is what you would access for an outpatient center like mine, versus on the Medicare Disadvantage plans, they're designed to help cover all of those additional costs so everything kind of gets swept under the rug under one thing. But like your mama said, ain't nothing free in life, and that's definitely true with these disadvantaged plans. So let's say you don't have a Medigap or a Medicare supplemental policy. You would owe 20% of your traditional physical therapy bill as you come in. The deductible is somewhere around $257, I think, for 2025, maybe the same for 26. So it's pretty low. So once standard Medicare, right? So once your deductible is met, if you didn't have a Medigap or supplemental policy, you'd be responsible for the 20%. So what is 20%? Roughly $15 to $20 a session, okay? That's again, if you didn't have some supplemental policy. You can discuss that with your provider. Say you're a little bit tight on funds, you're on a fixed income. You can talk with your provider and they can adjust the treatment times and what they do with you to help work out a plan so that your cost per visit is in a reasonable budget amount that you can afford. And it doesn't force you to say, oh, I can't afford therapy, even though I've just had this major joint replacement, that now you go off and you don't do exercises, the knee starts to hurt, and you don't get the full benefit of having that knee replacement. Now, we jump over to the disadvantaged plans. Frequently, those come with several gotchas, several catches that are linked into there. Most frequently is some type of authorization period, meaning when you come into therapy, they'll let us see you for that first visit, but then frequently we're having to turn in paperwork and information to your insurance company so now they can approve your future visits, even though the therapist and your surgeon both know that you need surgery. Mind you, they've already approved your knee replacement. They know what happens after a knee replacement, that you need some form of therapy. However, they drag their feet during the authorization process. So let's say they eventually approve it. Most of these plans have a visit limit. Let's say it's 20. Now 20 visits of therapy sounds like quite a bit. However, if you have some form of complication, you're severely deconditioned before you go into your surgery, you can theoretically use up 20 visits fairly quick trying to get your knee back in shape. And sometimes it's not even where you need it to be at that point. They have hard limits, meaning you can kick and scream and holler and write notes and fax and call, and they're not going to give you another visit. So you'll be locked in at 20. So then you're forced into either stopping therapy and trying to continue on your own or paying out of pocket to get the therapy that you really deserve. Not true with Medicare. Medicare lets us continue to see you through the ups and downs so that you get full functional mobility and strength out of your knee, and Medicare will continue to pay. We just document what is going on with you. On the Medicare Disadvantage side, again, frequently there are visit limits. Now, what about the cost? I said if traditional Medicare at 20%, maybe you're at $15 to $20 a session. Okay, and you have some flexibility to discuss that with your provider if you need to make some adjustments to fit your budget and your lifestyle. Not so with Medicare Disadvantage plans. Frequently, they'll hold $25, $35, $45, even $50, $55 copays have been some of the ones that we've seen from the Disadvantage plans, meaning more than likely you're covering a large portion of your therapy cost to the center through your copay. Frequently, we have several patients that come in, they've had the knee replacement, they didn't look into the benefits, didn't realize it was going to cost them $35 a session. Frequently, it's 3 times a week to come in, over $100 a month, over $100 a week for them to come in and get the therapy that they need. And they elect to either not do therapy at all, which is horrible, or they'll come into 1 session a week. They'll try to do it on their own at the house. It hurts too much, so they don't move it. They have no one else to coach them through, and they eventually drop out and have a very poor result after their knee replacement. Now, this is a very personal decision. You have to get together with your family members, and you have to really decide what type of health issues are you experiencing? What are you looking for in 2026? Do you have some bad knees? Do you have a bad shoulder that is going to need to have therapy? Maybe a surgery, maybe a joint replacement. If that's on the horizon, you really need to look at these plans, because they'll come in and they'll sell you the moon, right? And then they're going to cut you short when it comes to trying to get your proper rehab and your proper therapy. One more thing, you really need to confirm, if you are going to these disadvantage plans, that you get a full list of the physicians, especially the ones that you're currently seeing. We had a guy recently, he switched over to a different plan. He got on the plan, he was told his physician and his dentist was on this plan, and guess what? The dentist was not on the plan. So he is now holding off on getting dental repair work because he doesn't trust the guy that insurance wanted him to go see. And so he's waiting to get back onto traditional Medicare so then he can see the dentist that he wants to see. So I encourage you to take a look at these different plans. Again, discuss this with family members. Think about what other issues maybe you're having. And if you're going to need some therapy, if you're going to need surgery, if you're going to need joint replacements, you definitely need to look at those little nuances of, are there visit limits? What is the authorization process? And what is that going to cost me out of pocket every time I go to see the physical therapist or occupational therapist? Okay, so hopefully that's been helpful. You can tell where I definitely stand on Medicare versus Medicare Disadvantage plans. If you have any other comments or thoughts, please post them in the chat. And good luck shopping, because open enrollment is now October 15th. By the time now I'm shooting this video and you'll see it, it's October 15th through December 7th of 2025. Typical date range every year. So now is the time you can start to look at these plans, but do your homework. Okay, look at what is going on. Pull back the curtain on these things, and don't just listen to the slick salesman that's trying to get you to sign up for this disadvantage plan. All right, they're incentivized and they're trying to get you to sign up for a reason. And most of the time, it's not in your best interest. It's in theirs, because they get paid off commission. Okay, hope you guys enjoyed this and have a great day.